Antibiotic-resistant illnesses and fatalities have been on the increase, according to recent monitoring data. The most recent national surveillance data, presented today at the UK Health Security Agency (UKHSA) annual conference in Leeds, indicates that an expected 58,224 patients in England had an antibiotic-resistant illness in 2022, up by 4% from 2021, 55,792. The number of people who passed away as a result of diseases that were resistant to several antibiotics rose from 2,110 in 2021 to 2,202 in 2022. The usage of antibiotics in England fell dramatically between 2014 and 2020, with the largest decrease occurring in 2020 due to the epidemic. However, recent statistics suggest that antibiotic usage is rising in all areas, excluding dentistry, in 2022. Total prescription grew by 8.4% in 2022 compared with 2021, however remains below 2019 pre-pandemic levels. The development of antibiotic-resistant bacteria and a rise in fatalities from these diseases are both facilitated by the inappropriate and excessive use of antibiotics. While the rate at which bacteria develop resistance to medicines remains consistent, 1 in 5 bloodstream infections, overall, there are worrying increases in antibiotic resistance in particular bacteria. The bacterium Klebsiella pneumoniae, which may cause sepsis, is becoming more resistant to many of the antibiotics previously used to treat it. This is especially true of third-generation cephalosporins, where resistance is expected to rise from 13.5% in 2018 to 17.4% in 2022, and piperacillin with tazobactam, where resistance is expected to rise from 15.1% to 19.6% in the same time period. The antibiotic resistance burden varies among English groups, and this year's study dives further into those disparities than in previous years. Of all bloodstream infections observed, Asian or Asian British ethnic groups had nearly twice the prevalence of antibiotic-resistant infections, 34.6%, compared to white ethnic groups, 18.7%. Natural antibiotic resistance exists, however drug misuse and abuse may hasten its development. Serious problems, such as bloodstream infections, sepsis, and hospitalization, may result from antibiotic-resistant bacteria because these germs are less likely to react to therapy. Bacterial infections that are resistant to many antibiotics are far more dangerous than those that are susceptible to treatment. That's why you should only take antibiotics when your doctor says to. UK Health and Care Standards Authority CEO Professor Dame Jenny Harries said, "The challenge of antimicrobial resistance is here and now. It is not some distant threat. We hope that there will always be an antibiotic to treat us if we ever acquire a bacterial illness, but unfortunately this is not always the case. If we do nothing, access to life-saving medications will continue to dwindle, and we will be less effective at reducing infections, which will disproportionately affect people already living in poverty." Like, share, subscribe.